what was so amazing to watch is how efficiently and effectively corporate America itself actually moved virtual very, very fast. And I think that's going to be a permanent, I mean, we're all dealing with the permanence of that. That's going to be something that's going to become a permanent part of the fabric. I think the second thing the pandemic taught me on the insurance side is design matters. And I think hopefully that people don't lose this concept. When the CARES Act passed, Bind didn't have to do anything to change its health insurance policies. Because when you start with a condition first design, coronavirus is an infectious disease. How should we actuarially cover infectious disease? Well, you'd want to immediately, stop the spread. You'd want quick diagnosis and testing, and you want any therapy that could solve that condition as quickly as possible. All of those were already $0 copays for Bind. We didn't need the CARES Act to actually improve the design of Bind's insurance. And I think especially like this concept of deductible. Deductible doesn't belong in health insurance. It's an antiquated concept that was stolen from the property and casualty industry and doesn't fit epidemiology and human-centered design very well when you talk about health insurance. So I do think design matters. I think the third thing the pandemic taught us was the power of one. I remember when it first started, I would always ask people, what's the single biggest clinical weapon we have against the virus? And I use that term specifically, clinical, because I wanted them to think about that person in the white coat that we all think is clinical. And people would kind of like, I don't know, and then eventually you'd say, no, it's social distancing and wearing a mask and practicing good personal hygiene. And the reason I would frame it that way is because I think we've gotten so far away from understanding that we as individuals have the most powerful place to play in health and in care. And if we actually start to orient that, I think we can then take that power of one into the power of community. And I do think the challenge that this country continues to face is this idea of how you take the power of one into the power of community, and how do we all recognize that we have to deal with this together. And then the last thing I would tell you is just the power of discovery. And too often in this country, I think there's this belief that we need to find the best doctors or the best hospitals and just orient care to them. Well, look at the race on the vaccine. And what you really wanted is you wanted to have a wide open set of technologies and pharma concepts competing in that race. And in that race, we've delivered a vaccine at warp speed. No one would have, everyone, all the leading experts said there's no way it's going to happen within the calendar year of 2020, and they did it. And part of it was this race we've built in healthcare, especially in the US. We've fractured care delivery into these 1,000 points of light, and you want them competing with each other to actually continue to innovate treatments and solutions for consumers, especially when into conditions and diseases. So to me, I think there's a lot of really good things to take away from what the silver linings of what the pandemic has done in healthcare and in our corporations.